Therapy Playground. I'm Ashley.
And I'm Rebekah.
And today we are going to be talking about acid reflux and the effects that it can have on your child's feeding. First thing we want to talk about is the symptoms of acid reflux. Beck and I both work with children for feeding therapy, and some of the symptoms that I've seen and that have brought the doctor to the attention that there might be a problem is poor waking, sometimes the child has sour breath, spitting up or gulping, and they tend to have a very painful look on their face. Do you see that with your kids?
Mm-hmm. Yes, they do. They'll have a painful look on their face when they're eating. Sometimes it's so painful that you'll see them arch their back if they're infants when they're feeding. You'll also see refusals to nurse from the bottle or refusals to breastfeed. If they're older, you'll see food aversions as well.
Why do you think that they're averting the food?
Because of the pain. The reflux coming up is acid from your stomach coming up into your throat that can cause redness, swelling, irritation. So it's painful for them. And sometimes the swelling can cause difficulty with foods or liquids passing through the throat area. So it may feel like it's getting stuck or not going down like it should. And sometimes it can go down into the airway where, in that case, you might see some choking.
Yeah, I mean, in working with kids, you see this all the time, that they just start refusing the food altogether. Another thing you might see is problem with sleeping habits. Mm-hmm. Your child may be up crying during the night because of that pain that's going on. Are there any other ones that I'm forgetting that we...
Well, and one reason why you would see the sleeping habits not being so good is because when they're sleeping, if you have them laying flat, then you have reflux coming up from or the acid coming up from your stomach up into your throat area. So because they're laying in that flat position and not sitting or sleeping in a supine position.
Right, and I think it's also important for us to know is that your child's not going to have all of these symptoms. They may just have a few of them, and they may be more severe. Like they may vomit every time they eat, but they may sleep fine. So you really just need to look at the symptoms, and if your child just has a few of them, definitely talk to your doctor about it. We had brought up feeding momentarily about the negative association that's created. The reason that, like Becca was saying, you have all that irritation, and that's painful for the child. And they associate that it hurts to eat. But the problem is that even after, if it's a prolonged or a very severe case of acid reflux, the problem occurs after the medications take away the symptoms. Becca, can you explain that a little bit?
Yes, after the medication has helped decrease the symptoms of the reflux or the acid coming back up from the stomach, and the pain may not necessarily be there anymore, the child still has associated eating with pain. So then you're looking at a behavioral problem with feeding versus an actual physical problem with feeding.
And I think we see that a lot. We have our medical kids that are feeding for not eating or cannot eat for medical reasons, and we have our behavioral children. And these children, simply, they associate food with pain. And they associate that it is a bad thing. So that therapy is very hard. It's very hard because you have to change the child's ideology. What we want to inform you about is what you can do if your child does have acid reflux and it is affecting their feeding. We already talked about calling your doctor, and I guess parents probably want to know, what should they tell their doctor?
Right. Definitely tell your doctor the symptoms that your child is having. Let them know if they're receiving feeding therapy or not, and if it's been successful. You may even want to have your feeding therapist contact your doctor so they can discuss those things. Your doctor is probably going to give you a reflux medicine, and you're going to want to try it for maybe about a month, whatever they recommend. And then if you don't notice any changes, then you want to notify your doctor and let them know that nothing has changed. They may increase the dosage of the medicine, or they may change the medication before you notice the symptoms going away.
Yeah, and some parents, they may not want to go to medication right away. So other things that you can do is to alleviate the symptoms during sleep. And Becca had talked about, we typically lie down flat, and that is why we're feeling all that acid reflux. What you can do with your child is have a wedge pillow that looks something like this at an incline. So your child is laying down and that food can go straight into their stomach. What about during feeding? What can we do during the actual act of feeding?
Stay upright during feeding, and after eating, stay upright for 20 to 30 minutes. If you have an infant and they're not able to sit up in a chair or high chair, then you want to hold them at an incline while they're eating, or while you're giving them the bottle or they're breastfeeding.
Perfect. So I think we've kind of covered the basis of acid reflux and its effects on feedings. We've talked about the symptoms, the effects, the long-term effects, and what you can do if you do believe your child has acid reflux, or if your child has poor feeding habits at all. We thank you for listening to us today, and we look forward to talking to you again.